CEN Test Prep Exam Utah. Question 1. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A. No tetanus prophylaxis needed. Option B. A tetanus immunoglobulin only. Option C. Tdap or TD booster. Option D. A tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. Tdap or TD booster. Question 2. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects. Option A. Deep vein thrombosis. Option B. Acute arterial occlusion. Option C. Cellulitis. Option D. Compartment syndrome. The correct answer is option B. Acute arterial occlusion. Question 3. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A. Pulmonary fibrosis. Option B. Right ventricular failure. Option C. Left ventricular hypertrophy. Option D. Atelectasis. The correct answer is option B. Right ventricular failure. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Necrotizing fasciitis requires what priority treatment? Option A. Broad-spectrum antibiotics alone. Option B. Immediate surgical debridement. Option C. Hyperbaric oxygen therapy. Option D. Wound vac placement. The correct answer is option B. Immediate surgical debridement. Question 5. A patient leaving against medical advice, AMA, must be informed of. Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 6. The most common cause of acute renal failure in hospitalized patients is. Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Question 7. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A. Tachycardia. Option B. Narrowed pulse pressure. Option C. Hypotension. Option D. Tachypnea. The correct answer is option C. Hypotension. Question 8. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A. Neurological status. Option B. Renal function and urine output. Option C. Skin integrity. Option D. Cardiac rhythm and rate. The correct answer is option B. Renal function and urine output. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The purpose of administering surfactant to a patient with ARDS is to. Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 10. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes. Option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is option B. Abdominal pain, hypotension, and a pulsatile mass. Question 11. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates. Option A. Allergic rhinitis. Option B. Nasal mucosal secretions. Option C. CSF leak, rhinorrhea. Option D. Sinus infection. The correct answer is option C. CSF leak, rhinorrhea. Question 12. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. Question 13. The golden hour for acute ischemic stroke refers to the window for option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. Question 14. The most common cause of airway obstruction in an unconscious patient is option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. Question 15. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as option A. TSI level 1. Option B. TSI level 2. Option C. TSI level 3. Option D. TSI level 4. The correct answer is option A. ESI level 1. Question 16. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A. Uncompensated respiratory acidosis. Question 17. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A. Gray-Turner's sign. Option B. Cullen's sign. Option C. Murphy's sign. Option D. Rovsing's sign. The correct answer is option B. Cullen's sign. Question 18. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A. Open-angle glaucoma. Option B. Acute angle-closure glaucoma. Option C. A conjunctivitis. Option D. Uveitis. The correct answer is option B. Acute angle-closure glaucoma. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects option A. Hemorrhagic shock. Option B. Neurogenic shock. Option C. Cardiogenic shock. Option D. Anaphylactic shock. The correct answer is option B. Neurogenic shock. Question 20. Testicular torsion is a surgical emergency that requires intervention within option A. 24 hours. Option B. 4-6 hours. Option C. 2-3 days. Option D. It is not a surgical emergency. The correct answer is option B. 4-6 hours. Question 21. Which ECG finding is most indicative of hyperkalemia? Option A. Prolonged QT interval. Option B. Peak T waves. Option C. ST depression. Option D. Delta waves. The correct answer is option B. Peak T waves. Question 22. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 23. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 24. The most common cause of lower gastrointestinal bleeding in adults is Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Question 25. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection.